Okay, hi everyone, I'm Tom Randell. My project is on the assessment of breast cancer risk using machine learning on mammography datasets. My supervisors for this project are Pejman, Martin and Michael Clark, as we discussed. This project will be using the Measurement Challenge data. The Measurement Challenge is an international resource that provides a standardized set of mammographic images in hopes to better compare methods of measuring or predicting risk based on mammography images. It consists of 1,650 cases and 1,929 controls. These are from Malaysia, Australia, Norway, the UK and the USA. So this data set contains mammograms, the date that they were taken and the date that cancer was diagnosed, if that is the case for that mammogram. So I will be developing a machine learning model that can accurately predict risk using Python and specifically the PyTorch libraries. How we can sort of quantify how good a predictor is with receiver operating characteristic curves, which is shown here on the right. A better predictor is more to the left, like left and up, and the area under this curve sort of characterizes how good it is. An area of 1 is a perfect characterizer, and an area of 0.5, which is this black line, is essentially just flipping a coin to decide whether or not you will get cancer. I'll be using Amazon Web Services to train the model. Breast cancer. Breast cancer is estimated to be the most commonly diagnosed cancer in Australia in 2020. It has a 5-year survival rate of 91% and is the second most common cancer death for females in Australia. There are many treatment options. They're not always taken in isolation. They can be taken together for a single patient. The options generally include surgery, mastectomy or breast conserving surgery. This is where either the breast is removed or we attempt to just remove the tumour. Chemotherapy, which is using drugs to kill cancer cells. Radiation therapy, which uses radiation to kill the cancer cells. And then hormone and targeted therapy are sort of specific to breast cancer. It depends if the breast cancer has certain receptors, them being hormone receptors or a certain protein receptor for targeted therapy. So what is risk? The risk of developing breast cancer is like the likelihood of developing breast cancer in a given period. So we can think of as 1-year periods, 2-year periods, lifetime. And how we can approximate this is with studies, whether or not a person developed breast cancer in that time period. Some known risk factors include age, BMI, family history, and hormonal and reproductive factors. A lot of risk assessment research has been using these sort of traditional factors rather than mammographic factors. And so that brings us into our next part. Mammograms is the data that I'll be using for this project. It's an imaging modality that uses low energy X-rays. 20 kV is sort of typical, compared to regular X-rays, which use sort of 70 to 80 kV. It uses these lower energy X-rays so that we can better delineate between the soft tissues in the breast, because unlike in regular X-rays, we're not getting bones and other high dense things. We need really good contrast between soft tissues. This modality requires compression of the breast, which sort of makes it uncomfortable and even painful, but it is required to get better sort of, sorry, forgotten. I'll leave that for later. The two different views are craniocaudal and mediolateral oblique. This image here is a craniocaudal, and this is a mediolateral oblique. A craniocaudal is sort of top down, and mediolateral oblique is side on. Many countries have mammographic screening programs, Australia included. We have the Breast Screen Australia program, which provides women over the age of 40 with free mammographic mammograms every 2 years. And the aim of these programs is to catch cancer early so that we have better survival rates. Okay, so what factors might we see in mammograms that we can associate with risk? Previous research has mostly included density and texture features within mammograms. Density is the amount of bright pixels. Where do we define bright pixels? It's sort of subjective and decided person by person or by automatic software. So pixels that are above a certain threshold we will call dense, and those below it we'll call not dense. Density can either be percent density or dense area. Percent density is just the ratio of dense to total pixels in the breast. And dense area is just the total number of pixels that are dense. Texture is sort of a vague-ish term. It just sort of means everything else that we can imagine in the image. It contains spatial and pattern information. Finding ones that are predictive of risk is difficult. One study that I looked at actually had to look through 944 different ones and only found 5 of them to be significant. So that sort of difficulty brings us to the next part. Deep learning. So it's a class of machine learning algorithms that use multiple layers to progressively extract higher and higher level features from the input. A typical and common application of this is in object classification, and that's what we see in this sort of example here. We start with the input data, and this model seems to be extracting facial features. So it starts off with very simple features, eventually forming facial structures like eyes and noses and mouths, and then eventually full-formed faces. Deep learning is pretty useful in tasks which are difficult to develop a standard algorithm in, and one that we sort of just need to put in some data and find out how to let the machine find how to classify these things. How can this be used in my project? Well, as I discussed, finding the features in mammograms that are associated with risk is pretty difficult and requires a lot of trial and error. So we are hoping that we can find features in mammograms that correlate with risk using machine learning, and especially those which aren't obvious or intuitive. And that these weights are optimized to predict risk accurately of these features. So what have I done so far? So far we've sort of done most of the data processing on our data set. The aim is to always to get more data if we can. And going forward, I will need to study machine learning a bit more. I'm not an expert on it by any means. This will take maybe a month or two after I've finished the semester. I'll be finishing at around this time next year. So once I've gotten a grip on the area, I'll be moving towards developing a model and experimenting on it with the data. And this brings us to the sort of process you need to take when doing machine learning. After experimenting, we'll notice some areas where it performs well, some where it performs poorly, and looking at the breakdown of what sort of things it performs well on, like subsets of the data, and what it doesn't, which will lead to refining the model and also refining the data to make sure that it isn't cheating, so to say, using things we don't want it to. And then once I'm happy with that, we will perform analysis on the model. As I mentioned earlier, doing receiver operator operating characters curves to sort of analyze how well it performs, and then hopefully publish. What is the significance of this project? Well, and what can we gather when we have useful, good risk predictors? Well, better risk assessment allows doctors and clients to be better informed, make better decisions on what actions to take. One example decision that could be made is that high-risk individuals could be screened more often to make sure that so if they're high risk, it's more likely they'll develop it in between screenings, so we should test more often, and that way we can catch the cancer earlier. And yes, as previously said, early detection results in higher survival and better quality of life for the patients. And that's all. Thank you.
Perfect timing. Questions?
Yep, go ahead.
Last talk looks very interesting. So my question is, have you thought about what sort of pre-processing you may do to the images before you put them into a machine learning model?
Yeah, so we wanted to sort of make sure we extracted just the breast region. We don't really want it looking over into regions that aren't useful. That helps just to focus it in on it. Other things like normalization and stuff, not really sure. You would think that doing sort of too much changing of the image would change the sort of what those pixels actually mean.
Yeah.
So not too much, but yeah.
So I was going to say you could look into applying some morphological operations or extracting like high frequency information from the images.
Yep.
Just seeing that if that adds anything to the model.
Yeah, yeah.
Just as an experimental phase.
Yeah, the frequency domain could have some information in it, yeah.
Yeah, just to sort of briefly add to that as well, have you considered potentially incorporating some of the clinical variables that you have access to, like for example family history,
Yeah.
that kind of thing, into the model development?
The data set that we have doesn't really have a lot of it. It really only has the age and I think that's about it. And the weight.
That's unfortunate because in the
yeah.
research that I've been doing with prostate cancer, when you combine texture features with clinical variables as well, like PSA level,
Yeah.
other things as well, you get models that perform significantly better than
Yeah.
just using texture features like you mentioned. But I think you're planning on doing like a convolutional neural networks
Yeah.
anyway.
Yeah. In my research, I found similar things that you get combine both images and sort of history and traditional factors. And depending on the model, it definitely did increase them by a bit, but with the better models, it didn't increase it as much as you'd think. A lot of the information in the mammogram actually contains some of those sort of factors.
Yeah. Yeah, you could potentially derive them anyway, just
Yeah.
like plugging them into a deep learning model.
Mm.
David from Zoom has got a question.
Yep.
David?
Yeah, I have two questions. The first one is more technical. What are the strategies to mitigate overfitting?
Right. We would. So not all of the. There's an external set of data which the measurement challenge holds, So that can be tested on, but you only really do that once. So I agree that we might be overfitting before that point, but obviously we will be sectioning the data so that we're not using all of our data set as the training, and some of it will be used to validate and test it. And so seeing how it performs on those test sets should help us see if it's overfitting too much. Having a model with more layers generally overfits, and sort of experimenting with those is how we will deal with it.
Second question.
And the second question is, is there a way you could use time data? So you say, in one of your slides you said you're going to monitor people with high risk more frequently. Possibly, is there a way to use different mammograms from the same person but at different times?
Yeah.
Predict the onset of cancer.
Yeah, I agree. That was sort of an area that I was interested in learning and researching this. Sadly, the data set we have doesn't really allow us to do that, but I think it is definitely a sort of future research topic, is not sort of comparing one image, but using how the image progresses through time to see how their risk might be increasing or decreasing. I agree.
Any other questions from Zoom? All good? Any other questions here? Happy? Thanks very much, Tom.
Thank you.